Okay. Is it okay? Cannot, then we just use my.
Good afternoon, class.
Good afternoon.
Today I'll be teaching you about design of experiment. So how many of you have done experiment or involved in an experiment before?
Yeah.
No one?
Yes.
Yes? Very good. So when we look at design of experiment, what do you think? Why do we need to design experiment? The first thing that came into your mind.
It has to be properly planned.
It has to be properly planned. And why is that?
To know what is our objective and lead us to hit the objective.
Yes, that's right. So there are two types of design of the experiment. The first type is observational study. Hence the name. We study something by observing. The second one is experiment. Experiment, I think the science people, they always do experiment in the lab. So I think this is more towards the scientists. And what is observational studies? I said it is we observe and measure specific characteristics, but we don't attempt to modify the subject. Meaning we just look at the subject and see the behavior. For example, if we do a research comparing the risk of developing lung cancer among our subject matter, we don't ask someone to, can you please smoke for 20 years and I want to see whether you can get lung cancer. We don't do that, right? And also the same thing as we say to this person, please don't smoke for 20 years, we want to see whether you can get lung cancer. So that is observational and we have no control over that. So please remember, we draw a conclusion in a control group, but we have no control. So that's what we call observational study. Okay? Alright, everybody sleepy?
Yes.
Not yet? Understand?
Yes.
Okay. So the second one is experiment. So when we do experiment, we need to put some treatment in the experiment. So we need to do maybe some modification on the experiment. So treatment may refer to treatments in a medical sense. You know, we use different drugs to see what type of drug that is good for a certain people or children or something like that. And also in agricultural, in industrial experiment, something like that. And then the key point is something deliberate that is assigned by the researchers controlling the study. So, what is an example of experiment is patients are given lipital to determine whether this drug has the effect of lowering cholesterol level. So we know that if we give these drugs to a patient, we may have the effect of lowering of cholesterol. And if we have not given this drug to the patient, so maybe the cholesterol won't go down. So there is experimentation because there is some modification in it. Understand? Okay, since all of you understand what is observational studies and experiment, I'm going to give you time to put your thinking cap. Okay? So tell me, which one of these is experimental and which is observational? Okay, I'm just going to give you about 3 minutes to read, and after that you can tell me which one is experimental and which one is observational. I know. Oh no! Oh, no need 3 minutes. Okay.
Again.
Some students.
Can I answer it, teacher?
Yes, you can.
The first one is experimental.
Okay, and the second one is observational. Why do you say the first one is experimental? Oh my god.
I thought I get to be exclusive answer this time. Because we are doing something to the patients. We are doing you're giving drugs to the patient, and then in one group you are not giving anything to the patient. But in the example 2, you are just observing the subjects throughout the 20 years of the study. So you are not doing anything, you are observing.
Very good. Anyone else want to add? No? Okay. Next slide. Okay, so there are 3 definitions in observational study. So the first one is cross-sectional study. So data are measured at one point at a time. They are usually conducted to estimate the prevalence of the outcome of interest. For example, during when we have the H1N1, or I cannot think of anything right now. The second one is retrospective study. As the name goes, you go back in time to collect data. For example, you study the link between artificial sweetness linked to bladder cancer. You see whether, how long does it take artificial sweeteners to get bladder cancer. Next one is prospective or longitudinal or cohort study. So we go forward in time and observe group sharing common factors such as smokers, how long does it take to get lung cancer, so on and so forth. For experiment, the key element in designing this is we have to have a control effects, like I said just now, and control effects of variables through blinding blocks, completely randomized and experimental design. Anybody knows what is completely randomized experimental design?
I know that we know.
Oh, she knows.
I don't know.
You don't know? Okay, completely randomized is we have.
No bias.
Dr. Zainab.
Okay, Dr. Zainab, do you know?
Randomized, what I understand, basically is supposed to be no bias.
Mm-hmm.
That means the selection of samples should be have certain pattern, but it shouldn't be a bias.
Very good.
She's a doctor.
Oh, okay. Alright.
Mechanical cannot know this.
No? Okay. So the next one is verification. I think most of you know it's repetition of your samples. And randomization to give a chance that each sample has the same chance of being selected. Very good students. No. Not yet. So this is my last slide. Sampling approaches. So we have random sampling. Just now Dr. Zainab already told us what is random sampling. And then simple random sampling. It is the same with random sampling except that we have a size and object. Meaning that if I have 3 people in this room, 4 people in this room, and I want to take 2 people only, so I give you a number 1, 2, 3, 4. Then I give and I put the number in a hat, so you choose. So you know your number 1, 2, 3, 4. So I put everything that you wrote down in a hat, and I just take out a number. Oh, 2. So the Zainab, and then 3. Then we. So that is what you call simple random sampling. And systematic sampling, convenient sampling, meaning that if you feel like you want to know what is the effect of secondhand smoking to people, if you just go to this person and say, I know what is the effect, So conveniently she's just in front of me, so I just wait for people to come. That's all. So that is convenient sampling. And stratified sampling, we subdivide the group into at least 2, male and female, age, cluster sampling. And that's all. So this is my conclusion. Thank you very much for your attention.